Medicare Supplement Plan G versus Medicare Supplement Plan N. Which one is right for you? Today, we're going to look at that, and hopefully by the end, you will be able to determine which supplement is the right choice for you. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia. My goal is really simple. It is to help you make a wise and confident decision about all of your Medicare choices. So if you need help enrolling in a plan, trying to determine which plan is right for you, please reach out to me. You will see the contact information at the end of the video, as well as all the states that I am currently licensed in. If today is your birthday, then happy birthday to you. The more you praise and celebrate your life, the more there is in life to celebrate. Now let's take a look at the Medicare Supplement Plan G versus the Plan N. Currently, the Plan G and Plan N comprise 77.5% of all the Medicare supplement policies that are sold in the United States. The Plan G making up most of those at 85.4%, and the Plan N at 14.6%. So what is a Medicare supplement policy? More than likely you know, but just in case you don't know, what is a Medicare supplement policy, also known as Medigap? Answer: it is a secondary insurance policy that you purchase to supplement or fill the gaps that original Medicare doesn't cover. Things like coinsurance, copayments, deductibles, and foreign travel. What else is a Medicare supplement policy? Answer: it is standardized. They offer the same basic benefits from coast to coast. A Plan G is a Plan G no matter where you get it, regardless of where you live, except in Massachusetts, Minnesota, and Wisconsin, where they are standardized in a different way. The only thing that varies is the premium that you pay and perhaps some additional benefits like a fitness club membership or vision discount. Who is eligible for a Medicare supplement policy? You must have Medicare Part A and Part B, and you must be 65 or older, except in certain states. This is important. When can you get a Medicare supplement policy guaranteed? Number one, during your open enrollment, when you first turn 65 or first get Part B after 65. You have a 6-month window to get a supplement guarantee regardless of past or present health issues. This is where people make a mistake when it comes to Medicare. They think that no matter what their health is, because of what happened with the Affordable Care Act, where they couldn't decline you for anything, people think it's the same thing for Medicare supplement policies, and that just isn't true. You have brief times when you have a guaranteed issue right, so you need to take advantage of them if you want a supplement. Number two, when you've lost other credible health coverage after 65 that gives you a guaranteed right to buy a Medicare supplement. So you've been employed past 65 and you've had group insurance, or maybe you had retiree health insurance and they've canceled that. You now have a guaranteed right to get a supplement in most situations. Number three, when something happens to your Medicare Advantage plan that allows you a guaranteed right to buy a Medicare supplement. This would be if the Medicare Advantage company decides to terminate a plan. Usually in October, they'll send you a letter. They need to give you 90 days notice that your plan is terminating. And usually on the letter, it tells you that you now have special rights to buy a Medicare supplement policy. If you're on a Medicare Advantage plan and you move out of a planned service area or do a legal change of address, you also have a guaranteed right to get a Medicare supplement for a very brief period of time, and you can watch my video about that I will link in the description below as well. When can you get a Medicare supplement? Not guaranteed. Answer: when you have good health and can qualify through medical underwriting. So if you are outside of your open enrollment or you don't have a guaranteed issue, you can get a Medicare supplement later. If you are in good health, you don't have chronic conditions or some wacky drug, that is going to be an automatic decline for you. You have to go through medical underwriting. Who should really consider a Medicare supplement, especially when it's a guaranteed issue? First would be those people that have serious past or present health issues. You've got cancer, you've got kidney failure, you've got Parkinson's, anything that may cause you to go to the doctor, hospital, use certain services a lot. You want to seriously consider a Medicare supplement policy. Doesn't mean you shouldn't consider Medicare Advantage. It really just depends on your particular situation and the Medicare Advantage plans available in your area. You should consider a Medicare supplement If you need access to certain providers that don't accept Medicare Advantage plans, certain specialty hospitals do not take Medicare Advantage, or they are out of network and it will cost you more to go. Certain specialists don't take Medicare Advantage, whereas most of them are going to take your supplement. People that deal with mental health, a lot of them do not take Medicare Advantage, or they don't take it in network. So if you go see them, you're going to pay a higher fee. And if there just isn't a suitable competitive Medicare Advantage plan in your area, then you want to seriously consider a Medicare supplement. Who shouldn't consider a Medicare supplement? That's an interesting question. Who shouldn't consider a Medicare supplement? Well, there are a number of people that definitely should not consider it. Let's take a look at these. You're a Medicaid recipient, unless it doesn't cover your Part A or Part B cost sharing. So if you're on Medicaid and Medicaid is picking up your co-insurance, then that's like your supplement. There is no need for you to pay a premium for a Medicare supplement when Medicaid is taking care of it for you. You receive extra help, or LIS, which is low income subsidy from Social Security. That means your income is less than 150% of the federal poverty level. Now, unless you can afford the premium, or maybe you have a family member that can help you with the premium, then maybe a supplement is not suitable for you, because if you can't afford the premium, it doesn't matter. You qualify for financial assistance from your local hospital. So if you're somebody and you go to your local hospital because you're using hospital services, that could be chemotherapy, could be radiation, could be outpatient surgeries, MRIs, CAT scans, diagnostic tests, things like that. Most hospitals have a financial assistance program that if you qualify for, they will write off all or part of the co-payments on there. So if you had access to that, then you probably don't need a Medicare supplement policy. Let's take a look at this eHealth survey that they did a while ago in regards to Medicare Advantage enrollees. Take a look at this. This is important. It says nearly 3/4, 73%, can only afford monthly premiums of $50 or less. So almost 3/4 of Medicare beneficiaries can only afford a premium of $50 or less. Right there throws out the vast majority of Medicare supplements. The only supplement you're going to get for under $50 typically is a high deductible G, and you could watch my video about the high deductible G, Medicare's best kept secret, and you can learn more about that. That is a great plan for the right people, but there's very few right people that plan is suitable for. If you look here, it says 14% say they could afford monthly premiums of $50 to $100. So most people simply cannot afford to pay the premium on a Medicare supplement policy. And then some states, depending on where you live, are really, really high on Medicare supplements, and other ones are a little bit lower. So what does the Plan G cover? If you take a look at the Medicare New Book, you will see that it covers absolutely 100% of everything except the Part B deductible. Once you've met that, Medicare pays everything except when it comes to foreign travel. If you travel outside the country and you have a Medicare supplement policy, it will pick up some of your foreign travel. I recommend you get travel insurance if you are traveling. What does the Plan N cover? Pretty similar to the Plan G. It will cover 100% of everything that Medicare doesn't cover, except the Part B deductible, and then certain office visits, you would have a copayment of up to $20, and the ER, you would have a copayment of up to $50. So it's up to, it's not a guarantee that it's 20, it could be $1, it could be $3.70. We don't know. It just depends on the bill that you receive. And then also with a Plan N, you would be responsible for any potential what are called excess charges. So what is an excess charge? So an excess charge kicks in when you have seen a provider that does not take Medicare assignment. And 97% of the doctors take Medicare assignment. So if you have a Plan N and you go see a provider that does not take Medicare assignment, you are responsible for 15% above the Medicare approved amount. So let's take a look at an example of a Plan N, and you incur an excess charge, which would be rare, but you could. So let's take a look at this. You go to your doctor, and the doctor charges $400 for his service to you, whatever he does. But Medicare only allows $200 for that visit. So Medicare will pay 80% of the $200, or $160. Your Medicare supplement Plan N, after the Part B deductible is met, will pay 20% of the $200, or $40, minus your copayment of up to $20. And then you would pay 15% of the $200, which is $30. So the most you would pay would be $50 on this $400 office visit that you had. It'd be your co-payment of up to $20 plus 30. 30 definitely, and then up to 20. So at the most it'd be 50. Again, it could be $30 and change. It just depends. That's the most that you would have to pay on a plan N. All right, let's take a look at rate comparisons over time, because this is kind of eye-opening for some people and what happens over time. So any Medicare supplement policy is going to go up in price every single year, typically, because you go up in age every year and there is healthcare inflation. So the longer you have a supplement, the higher the premium will get. I typically tell people that they can expect their supplement to go up anywhere from 2 to 10% or even higher. I just recently saw somebody, they went up 14 or 15%. And it is not uncommon to start out in a supplement and see your premium double in a span of 4 to 5 years. It just depends on the plan you get, the company that you get it with, and perhaps where you live as well. What I'm doing is I am taking a look from age 65 to age 80, comparing the Plan N versus the Plan G. And we're going to go with Plan N increasing at 7.5%, because usually the Plan N does not go up as much as a Plan G, and the Plan G going up at 10%. And we're going to look at that over time. And this is based on a 65-year-old male. There's no discounts involved, no household discounts. That's a guaranteed issue. And these are the rates presently as of today in the Charlottesville, Virginia area. So let's take a look at this. So it's 65, a Plan N can be had for $78.05. A Plan G is $103.57. So the difference we have is $25.52 per month, or $306.24 per year. So the idea would be here, as long as you don't have to pay up to $20 for doctor visits, certain doctor visits, and up to $50 for the ER, if you're out of pocket, not counting your Part B deductible, because that's the same for the G and the N, is less than $300, then the Plan N is the better choice for you. But if you look at over time, if we factor in the 7.5% increase every single year, let's go out to age 70. You're now at $112.05 for your Plan N and $166.80 for your Plan G. Now, all of a sudden, we've got a difference of $54.75 or $657. We're starting to get into more substantial annual savings. Let's take it all the way out to age 80. At age 80, you're at $230.94 on the Plan N and $432.64 on a Plan G, a difference of $201.70 or $2,420.37. And you could have a total savings if you just let this pan out over time, over a period of 15 years. Your total savings from a Plan G going to a Plan N would be $17,446.02. So this is just an example. There's no guarantee that they're going to go up at 7.5% each year or 10% every year, but it should give you a good idea of the breakdown and why the Plan N may be better suited for you, for the cost savings that you can have over time. Take a look at the chart showing basically the same thing. The red is our Plan G, showing it go up over time. The orange is the Plan N. The green is the difference, and the blue down at the bottom shows your annual savings that you would have every year. So which should you choose, the Plan G or the Plan N? Let's look at this. You should choose the Plan G if you currently or will likely frequent the doctor office 7+ times per year. You just don't want to worry about having a copayment at all, and you don't care about the substantial premium savings over time. Otherwise, you should choose a Plan N. What if I already have a Plan G or a Plan F or some other plan from Medicare? Answer: contact me for a free rate quote and discuss whether you might qualify for a new Medicare supplement at a lower rate. Only contact me if you live in one of the states that I'm licensed in, which you will see at the end of the video. And just remember, you must go through medical underwriting to be approved. There is no guarantee that you will be approved, but if you're relatively healthy, it's probably worth a try. So on here, on this, what you're looking at are what are called uninsurable health conditions. So if you pause the video and you take a look at that, take a snapshot of it, you get an idea. If you have any of those, you just aren't going to be able to get a Medicare supplement unless you happen to have a particular guaranteed issue right, or you live in certain states that do offer guaranteed issues certain times a year or year round or on the anniversary of your policy. But most states aren't like that. It's maybe about 25% of the states that you have a guaranteed right. If you have questions, if you need help, If you want to get a rate quote on a Plan G or a Plan N, or you're turning 65 and you're trying to decide what to do, by all means, reach out to me. That's what I'm here for, to help you enroll in the right plan, to help you make a wise and confident decision about all of your Medicare choices. You go to my website, you'll see a couple contact pages on there. You can contact me through there. If you live in any of the states here, these are the other states that I'm licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee. And if you happen to live within about an hour or so of the Charlottesville, Virginia area, and you would like to meet in person at a safe, convenient location, then we can arrange that as well. Just reach out and tell me you would like to meet in person. And here's where you can help me out. Put down in the comment section below whatever state you're watching from. That gives me a good idea where people are watching from and what other states I need to get licensed in. Please like the video if you have found it helpful. Please subscribe for further content coming down the road. And who do you know that could benefit from this information? Then by all means, share this video with them. So that's it for today. I'm Chris Prang, the Medicare analyst. That's the Medicare supplement Plan G versus the Plan N. Make it a great day.